Welcome to section 5 of bacteria. This is our bacteria overview figure. In this video, we'll be discussing Bacillus anthracis, which you can see right here. For this scene, we thought a giant ant hill would work well. Ant sounds like anthracis, so in this image, the giant ant hill should help you remember Bacillus anthracis. We've also shown some purple tents here because some hikers decided to set up a camp in this unfortunate spot. Who knows what they were thinking? Maybe they enjoy being eaten alive by ants while they sleep. Regardless, the purple color of the tents here should help you remember that Bacillus anthracis is a gram-positive organism. The tents will also be used to represent something else, which I'll discuss in a minute. But for now, just think purple color for gram-positive. This is a gram stain of Bacillus anthracis. Notice that the organism stains purple and is rod-shaped. Next, notice that we've shown several mounds extending away from the giant ant hill. This is meant to resemble a medusa head, which should help you remember that when Bacillus anthracis is cultured, it forms colonies with curled extensions at the edges, and that these are sometimes referred to as a medusa head. So several mounds going away from the hill that look like a medusa head for medusa head. Next, notice that we've added some hikers to the scene. These are the foolish goons that decided to set up camp right next to a huge ant hill. They must not be too afraid of the ants because they're right next to them. Anyways, notice that this guy's coat and the girl's boots are made of wool. The wool here is to help you remember that individuals who handle wool or animal hides are at an increased risk of developing infection. This is why Bacillus anthracis is also sometimes called Woolsorters disease. So wool clothing for increased risk in people who handle wool. Notice that we've shown this girl holding an inhaler. Inhalers are commonly used by asthmatics to facilitate oxygen delivery to the lungs. So it can be thought of as a symbol for aerobic organisms, which are bugs that grow well in the presence of a lot of oxygen. So in our images, we'll be using inhalers as a symbol for aerobic organisms. Unlike the Clostridia species, Bacillus anthracis is an aerobic microorganism, so it grows well under aerobic conditions. So asthma inhaler for grows well under aerobic conditions. We've also shown this guy enjoying some M&Ms. He appears to be enjoying them a bit too much, as you can probably tell by all of them falling out of his mouth and onto the ground. Just like in our Clostridium botulinum image, the M&Ms here should help you remember that Bacillus anthracis is a spore-forming organism. Now we've added a backpack to the scene. They're campers after all, so a backpack seems pretty fitting. Notice that some edamame is poking out of her backpack and is falling on the ground. Edamame sounds like edema, so in this image, it's used to represent edema factor. Edema factor is an exotoxin and is one of 3 virulent proteins produced by Bacillus anthracis, so edamame for edema factor. Edema factor works by mimicking adenylate cyclase, which causes increased cyclic AMP. CAMP spells camp, so we thought the tents would be helpful in remembering that these two hikers are camping. Therefore, the purple tents should help you remember that Bacillus anthracis is gram-positive and that edema factor increases cyclic AMP. As the toxin causes cyclic AMP levels to rise, it results in edema, which is why the toxin is called edema factor. Okay, now we've added a bunch of ants on this girl's backpack. They've probably picked up on the scent of food from all of that edamame falling out of her backpack, and now they're trying to get to it. The fact that the girl's backpack is protecting her from all of the ants biting her back should help you remember that another virulent protein of Bacillus anthracis is protective antigen. Very simply, protective antigen is produced by the bacteria and is a binding moiety for edema factor and lethal factor. We'll talk about lethal factor in a second. Interestingly, protective antigen is called protective because when our antibodies bind to it, they protect us from the infection. However, don't get confused and think that protective antigen is something humans produce. It's a dangerous toxin produced by Bacillus anthracis. So again, backpack protecting the hiker girl from ant bites for protective antigen. The third virulent protein produced by Bacillus anthracis is lethal factor. To represent this, we've added this sign with a skull on it. The sign was placed here because somebody thought it would be a good idea to warn other travelers about this huge ant hill. However, these two goons clearly don't seem to care too much. A skull is kind of like a symbol for lethality, so we thought a skull sign would work well for lethal factor. Lethal factor is thought to be associated with cutaneous anthrax, which we'll discuss in a minute. So, skull sign for lethal factor. Okay, now let's discuss the unique capsule of Bacillus anthracis. Notice that we've shown this hiker guy burning ants with a magnifying glass. Maybe they decided to camp here with full knowledge about the anthill after all. Perhaps they're sinister and enjoy torturing ants. Anyways, let's zoom up on these poor ants right here getting burned so you can see what's going on. Notice that these two ants are stuck together. They were lifelong mates, but unfortunately, the punk hiker guy has burned them so severely that now they're stuck together. So I guess you could say that the mates are glued together. It may be a bit of a stretch, but mates glued together sounds like glutamate. So this is how we came up with D-glutamate. For step 1, you need to know that Bacillus anthracis is the only bacterium with a polypeptide capsule and that its capsule contains D-glutamate. So mates glued together for D-glutamate capsule. Okay, let's zoom back out and continue with the story. Before we go any further, you should know that there are 2 major clinical features of anthrax, including cutaneous anthrax and pulmonary anthrax. We'll discuss pulmonary anthrax first. Notice that as the hiker guy burns this big ant right here, that smoke rises into the air, which causes him to cough. This is why M&Ms are spewing out from his mouth and onto the ground. If you look closely, you can see that some of the M&Ms are red and look kind of like red blood cells. We've created the image this way as a symbol for pulmonary hemorrhage. So coughing up red M&Ms that resemble blood for pulmonary anthrax causes pulmonary hemorrhage. Also notice that the red M&Ms have landed on his chest right where his mediastinum is located. We've shown the M&Ms here to help you remember that the pulmonary hemorrhage can progress to mediastinitis. This is also why a chest x-ray may show a widened mediastinum. So red M&Ms on his chest for pulmonary anthrax causes mediastinitis with widened mediastinum on chest x-ray. Okay, let's review. As spores are inhaled, they are engulfed by alveolar macrophages, which deliver the spores to the mediastinal lymph nodes. Here, the spores germinate into vegetative bacilli. As the organism continues to multiply, it causes pulmonary hemorrhage. Eventually, it causes mediastinitis, disseminates through the bloodstream, and results in shock and death. Okay, now let's discuss cutaneous anthrax. Notice that we've shown this big black ant biting the hiker guy's hand. He probably deserves it considering he's mindlessly torturing ants. Anyway, we've added this part of the scene to the image as a symbol for cutaneous anthrax. This is characterized by a painless papule that progresses to a necrotic ulcer with black eschar. The big black ant looks like black eschar, and the fact that it's biting his skin should help you remember that an ulcer with black eschar is seen in cutaneous anthrax. In rare circumstances, the bacteria can disseminate through the bloodstream, which may be lethal. So again, black ant biting the hiker guy's hand for ulcer with black eschar seen in cutaneous anthrax. This is a picture of cutaneous anthrax. Notice the ulcer with black eschar on his neck right here. Finally, notice that we've added a flower-looking staff in the hand of the hiker girl. This is our symbol for fluoroquinolones. Flower sounds like fluoro, so we thought this would work well. Anyways, the flower staff should help you remember that one effective treatment regimen for anthrax includes fluoroquinolones. So flower staff for fluoroquinolones. Okay, now that we've covered the image, let's review with a question. A 37-year-old male is admitted to the hospital due to 3 days of fever, shortness of breath, and a recent episode of hemoptysis. He works as a shepherd during the summers, has no smoking history, and denies any recent travel. A sputum gram stain reveals gram-positive rods. Which of the following is most likely true regarding the microorganism? A, the polysaccharide capsule is antiphagocytic. B, one component of the exotoxin complex results in increased levels of cyclic AMP. C, the toxin inactivates elongation factor 2. Or D, it is an obligate anaerobe. Hopefully from the question stem, you notice that this patient had an episode of hemoptysis, works as a shepherd, and a sputum gram stain revealed gram-positive rods. Together, these findings are suggestive of pulmonary anthrax. Recall that individuals who handle wool or animal hides are at an increased risk of developing infection. So the fact that he works as a shepherd is suggestive of this risk factor. Okay, with this in mind, the correct answer is B. Recall that edema factor mimics the effects of adenylate cyclase, which results in increased levels of cyclic AMP. A is incorrect because while capsules are antiphagocytic, Bacillus anthracis has a polypeptide capsule, not a polysaccharide capsule. C is incorrect as this is describing the diphtheria toxin. EF2 is associated with protein synthesis, which is not directly affected by Bacillus anthracis. Finally, D is incorrect because Bacillus anthracis is an aerobe, not an anaerobe. From the image, recall that the tents and the camping scene here represents that edema factor mimics adenylate cyclase and increases the levels of cyclic AMP. So camping for increased levels of cyclic AMP.